working tirelessly alongside colleagues, campaigning to try and save Hurley Hospital, renowned speaker around issues surrounding the NHS, and we know that their fight is our fight. Jenny, you're very welcome.
Thank you. We're here. Obviously, there's loads going on with the NHS. You've seen that you're facing the same problems in the NHS as we are in education. It's the same theories, it's the same way they're trying to cut things back and that affects all of us. So I'm going to start by giving a brief overview of the privatisation. And the thing I hear most is how terrible it is that they're planning to privatise it. Well, they're not. They've already done it. You know, they've just split it up into 42 little areas, little money pots. So it's not a national health service anymore. It's 42 care packages, 42 profit packages. I mean, just look at the change in legislation. You know, if you don't believe they're doing it, the Health and Social Care Act of 2012 started the restructuring into a business model. I'm not going to go into all the details, but one of the things that was brought about there was that the Secretary of State for Health and Social Care was no longer obliged to provide health services under the legislation. The Health and Care Act of 2022 finished that process off. Right? As I say, they've now split it up into 42 little money packages. We no longer have, in law, a national health service. And who benefits? Private companies. Private health companies that are based mainly in the US and have umbrella companies over here like Operos. They're part of Centene, one of the biggest health companies in the US. But also remember that this is to promote private health insurance. You know, there's two sides to this coin, and it's not all inclusive. Insurance is an extremely exclusive product. Anything high risk or costly, you don't get. So you don't get that health care. Now, the way they're actually opening up that market for these is to create the market itself. So they're removing treatments and medications from the NHS that you can only get in private health. They're implementing personal health budgets, a set cost per annum, and if demand exceeds that budget, your waiting lists will get pushed out even further. Private contracts providing the bare minimum to ensure profit. Reduce expensive services such as A&Es, maternities, heart and stroke services. And of course the reason we're here today, and that's to provide staff as cheaply as possible. This is what we've seen. Public sector pay freeze since 2010 for 7 years. Nurses were then offered a 3% pay rise over a 3-year period, so below inflation. They've now been offered a 3% pay rise with inflation at 11+%. And this has led to a 26% pay cut since 2010. Junior doctors, the same pay freeze. 2015 strikes to accept bad terms and conditions and lower pay. They've been introduced to a 35% pay decrease. Bursaries cut so students doing 12-hour shifts have to pay for every single life cost, as well as their own education. Training placements cut so there's no advancement possible within their sector. This has led to 133,000 vacancies across the NHS. And we have to remember, if there's no staff, there's no healthcare. Just the same as if with no teachers, we have no education.
That's right.
We're seeing fewer student entrances, more early retirements, specifically in maternity and GPs, unsafe staffing levels for staff and patients. We sometimes see one nurse on a ward where there should be 4. It's appalling. Paramedics going out, waiting lists of 24 hours to be picked up for life-threatening situations. And of course, the longer these waiting lists go on, the better the requirement for the private market. Now, unions, let's just say, unions have been fighting for this, but not enough compared to the rank and file, what they want. In 2020, when unions accepted the 3% over 3 years, the growing movement of rank and file members of healthcare got angrier. The RNC sacked off the executive and voted in a new one. NHS workers say no, and other rank and file groups up the ante, and here we are today. We've got Unison, JMB, Royal College of Nursing, Unite and the BMA, all balloted, and we've seen the strike action. The government is still refusing to meet junior doctors with anything substantial. Our healthcare workers were offered 6% below inflation rise for 1 year, and only a non-consolidated one-off payment for 2023. And this offer favours the higher band grades rather than those most vulnerable in the sector. So here we are, Unison, JMB and Royal College of Nursing all advised to accept this offer. Unite said they couldn't accept that. The Royal College of Nursing had voted to reject. Unison announced that they'd voted to accept. Tomorrow is on the 28th. The ballot closes for the JMB and Unite, and these results are going to be pivotal. This is why we need to support them. If we have no staff, we have no NHS. When the junior doctors announced strikes, the government immediately attacked them and tried to isolate them. When the government made the last offer to health workers, nurses, namely the RCN, were offered a separate and better pay grade to isolate them. When they voted to reject, the government targeted nurses and actually said, we're going to target nurses. For this reason, we need to support all workers in this sector. We can't allow this shower of a government to divide and conquer us.
Yeah.
We need to be shouting for organised action to show we stand together, staff and public alike. We need organised action to have the most short-term impact on service provision. 3 days all out in the NHS is far more powerful than reducing the sections that trusts are covering with other people. They have no option but to cover their striking workers. So today, we call for healthcare publicly run, publicly owned and free at the point of need. Our own catchphrases need repeating as much as possible. We're calling for a time of back to Bevan. We call for all-out organised strike action across all health unions to save the NHS. Remember, the NHS will last as long as there are people willing to fight for it. Solidarity to all the workers and solidarity to the NEU. Thank you.